Hi everyone, welcome back to my channel. In today's video, let us solve some CPC exam sample questions. Watch this video till the end because in this video there will be questions from various chapters. Let's start with the first question. Before that, don't forget to hit the like button, share this video and subscribe to my channel. First question. What form is used to submit a provider's charge to the insurance carrier? Option A UB04, Option B Provider Reimbursement Form, Option C CMS 1500 and Option D ABN. So what is the correct answer? The correct answer is Option C CMS 1500. It is a form which is used to submit provider's charge to the insurance carrier. This is very important. Make a note of it. Next question. Which condition results from an injury to the head? The symptoms include headache, dizziness and vomiting. Option A meningitis, Option B concussion, Option C epilepsy and Option D Parkinson's disease. The right answer is Option B concussion. It is a condition which results from an injury to the head and the symptoms will be headache, dizziness and vomiting. Next question. What do the instructions and conventions of the classification take precedence over? Option A CPT, Option B documentation, Option C official coding guidelines, Option D nothing. They are only used in the event of no other instruction. The right answer is Option C official coding guidelines. Next question. According to ICD guidelines, when a patient is seen for management of anemia due to malignancy, how is it reported? Option A anemia is reported first, followed by the code for malignancy. Option B malignancy is the only condition reported. Option C anemia is the only condition reported. And Option D malignancy is reported first, followed by the code for anemia. The right answer is Option D. Malignancy is reported first, followed by the code for anemia. You can find this guideline in your ICD-10CM manual, Chapter 2, Neoplasm. Below that, you can see anemia associated with malignancy guidelines. So, the malignancy is reported first. That is when admission is for management of an anemia associated with malignancy and the treatment is only for anemia. The appropriate code for malignancy is sequenced as the principal or first listed diagnosis followed by the appropriate code for anemia. Okay, next question. This is from ICD-10CM. We'll solve this question by using elimination method. We'll check the options first. Check option A D49.2. D49.2 is for neoplasm of unspecified behavior of bone, soft tissue and skin. And option B C49.3 is for malignant neoplasm of connective tissue and soft tissue of thorax. And option C C79.89 it is for secondary malignant neoplasm of other specified sites. And option D D36.7 is for benign neoplasm of other specified sites. Let us read the question they have given. A 50-year-old patient has mass removed from his chest. The surgeon sends it to pathology. The pathology report indicates the mass is a benign tumor. Okay. The right answer for this question is option D, D36.7. Why? Because it is for benign neoplasm of other specified sites. We'll eliminate option A, D49.2. Why? Because it is for neoplasm of unspecified behavior of bone, soft tissue and skin. That is not matching with the question. Okay. We'll eliminate option B, C49.3 because it is for malignant neoplasm of connective tissue and soft tissue of thorax. In the question, they have not given malignant neoplasm. So, we'll eliminate option B and option C, C79.89 is for secondary malignant neoplasm of other specified sites. That also will be wrong. The right answer will be option D. Next question, we'll check the options first. Check option A 11400. 11400 is for excision of benign lesion including margin except skin tag. Trunk, arms or legs, excised diameter 0.5 cm or less. We'll check only the first code from each option. So let's check option B, first code 11106. 11106 is for incisional biopsy of skin, example wedge, single lesion. And option C also they have given 11106, and in option D they have given 11400. Now let us read the question. Patient has a suspicious lesion of the right axilla. The area was infiltrated with local anesthetic, prepped and draped in a sterile fashion. With the use of a scalpel, the 0.3 cm lesion that included the margins were excised and closed with 5.0 proline suture. Pathology report indicated this was a seborrheic keratosis. What CPT and ICD codes are reported? So here, first let us check between these two codes, that is 11400 and 11106. In the question, they have given patient has a suspicious lesion of the right axilla. Axilla is considered part of the trunk in medical coding. So, we can use the code 11400, and the size of the lesion is 0.3 cm, and in the code 11400 it is given diameter 0.5 cm or less. So, we can use that code. We'll eliminate option B and C, that is with the code 11106, because it is for incisional biopsy of skin. In the question, they have not given incisional biopsy, right? Therefore, eliminate option B and C. Now we are left with option A and D. We have to check between the two codes, that is ICD codes L82.1 and L82.0. Let us check those two codes. L82.1 is for other seborrheic keratosis and L82.0 is for inflamed seborrheic keratosis. L82.0 will be wrong because it is for inflamed seborrheic keratosis. In the question, they have not given inflamed seborrheic keratosis, right? They have only given seborrheic keratosis. Therefore, we have to use the code L82.1. So, the right answer will be option A. This is a case study question. Let us see the name of the procedure. Right breast reduction, right free nipple graft, left breast reduction, left free nipple graft. And let us directly check the codes. In option A and D, the code is 19325, and in option B and C, the code is 19318. So let us check these two codes. 19325 is for breast augmentation with implant, and the code 19318 is for breast reduction. In the description of procedure, we can read, on each side the free nipple grafts were harvested. Just by looking at the name of the procedure, we can find that the procedure is breast reduction. Therefore, we can eliminate option A and D, which is for breast augmentation with implant. In the question, they have not given breast augmentation. Now we are left with option B and C, that is 19318. In option B, they have appended modifier 50. Modifier 50 is for bilateral procedure. In this particular scenario, both breasts were reduced. Therefore, we should append modifier 50. The right answer is option B. Okay. Next question. Let us check the options first. Check option A, 38207. 38207 is for transplant preparation of hematopoietic progenitor cells, cryopreservation and storage. Option B, 38204 is for management of recipient hematopoietic progenitor cell, donor search and cell acquisition. And option C, 38205 is for blood-derived hematopoietic progenitor cell harvesting for transplantation per collection allogenic. And option D is for blood-derived hematopoietic progenitor cell harvesting for transplantation per collection autologous. Now let us read the question. A patient with AML, that is acute myelogenous leukemia, has just learned his sister is an HLA, that is human leukocyte antigen match for him. Stem cells were taken from the donor, that is the patient's sister. It will be transplanted into the patient to help with this treatment. What CPT code is used to report the harvesting of stem cells from the donor? So what is the right answer? The right answer will be option C, that is 38205. We'll eliminate option A because it is for transplant preparation of hematopoietic progenitor cell, cryopreservation and storage. In the question, they have not mentioned transplant preparation of hematopoietic progenitor cells, cryopreservation and storage. They're asking to code for harvesting of the stem cells. Therefore, we'll eliminate option A. And option B is for management of recipient hematopoietic progenitor cell, donor search and cell acquisition. In the question, they have not given management of recipient hematopoietic progenitor cell. 38206 in option D will be wrong because it is for autologous. So what does autologous mean? Autologous means transplant using the patient's own stem cells. But in the question, the stem cells are taken from the donor, that is the patient's sister. That is allogenic. Allogenic means transplant using stem cells from a donor. Therefore, we have to code for allogenic, not autologous. Make a note of this in your CPT manual, what is allogenic and what is autologous. Okay, next question. Which of the following are auditory ossicles? Option A, incus and pinna. Option B, stapes and mastoid. Option C, tragus and malleus. Option D, stapes and incus. The right answer will be option D, stapes and incus. Auditory ossicles are three tiny bones in the middle ear, that is malleus, incus and stapes. In option D, they have given stapes and incus. So, the right answer is option D. Incus and pinna are wrong because pinna is the outer ear, it is not an ossicle. Stapes and mastoid is wrong because mastoid is part of the skull behind the ear, it is not an ossicle. And tragus is part of the external ear. Therefore, the right answer will be option D. So that's it for today. Thanks for watching. I will see you in the next video.